Welcome to the dvm360. Give us 5 minutes and we'll update you with the veterinary news, medicine, and business information you need to know right now. I'm veterinary economics and Firstline editor Brendan Howard. In this edition of The 5, we'll get an expert's take on competing with big box chains and hear about the difficult topic of end-of-life pet care. First up, the news. Frank's Pharmacy has issued a recall on all sterile human and veterinary compounded prescriptions that were distributed dating back to November 21, 2011. The U.S. Food and Drug Administration recently notified the Florida-based pharmacy that an environmental sampling of its clean room revealed the presence of microorganisms and fungal growth, which presents a possible risk of infection and subsequent patient illness. Anyone in possession of these sterile preparations should discontinue their use and destroy remaining quantities. Any adverse events that have resulted from the use of these recalled products should be reported immediately to Frank's Pharmacy and FDA's MedWatch program. State Farm Insurance paid more than $109 million as a result of the nearly 3,800 dog bite claims filed in 2011. The Insurance Information Institute estimates that insurers across the country paid nearly $479 million total in dog bite claims last year. State Farm says dog bites are a serious public health problem that can cause both physical and emotional damage to victims and considerable cost to communities. The company lists California, Illinois, and Texas as the states with the most claims in 2011. Check dvm360.com to see who else rounded out the top 10. Pet owners have ever-increasing options for where to purchase pet medications, and many veterinarians are wondering how exactly they can compete with Walmart and Target for pharmacy business. Veterinary market expert Dr. Mike Paul weighs in.
I don't think we can compete with a Walmart or a Walgreens or a Target or any of these mega box stores who decide that they want to get into the veterinary care arena. They can just flat out spend us. And so what we have to do is accept them as an ally on some levels and learn from them on other levels and do what we do best that they can't do. And that's to develop that relationship with pet owners, to develop that trust and confidence. You know, we know pet owners want a relationship. Of course they want care, of course, but they expect that. You know, and meeting their expectations is not enough, because expectations don't fulfill their wishes. What we have to do is say, okay, what can we do above those expectations? And above those expectations, we get into things like relationship building, we get into things like experience, we get into things like personal connectivity with the client, and those are the kinds of things that we can do that the big box stores and the low-cost practices can't do.
Coming up, Dr. Kevin Fitzgerald shares some wise ways to hold on to your clients. But first, pets are living longer, healthier lives than ever before. Dr. Robin Downing says we owe it to clients to discuss end-of-life options for their pets.
I think that we as veterinarians need to start thinking about end of life as a distinct life stage in our patients, because our patients are living longer and better than ever before. So the challenge of talking about end-of-life options with the client, really the first and most important step is for us to understand what are the diagnoses that are relevant for the pet. What are the issues the pet is dealing with from a medical standpoint? Then setting some priorities about what symptoms we'll control and what diseases we'll treat and how best to treat those diseases. All boils down to educate ourselves and then educate our clients, all for what is in the best interest of the pet.
The biggest reason that in two recent surveys that people leave their veterinarian is inaccessibility to the veterinarian. They're not there for them. They can't get a hold of them. They don't answer their questions. They don't answer their phone calls. They put them off to another staff member to explain things to them. I think other things we can do is every film we take, we should show to the person. And if the people pay for it, they should see it. If they get blood work, they should see the blood work and have it explained to them. If they have a histopath done, this is a copy of the histopath of your animal, and here's what the pathologist said. Then even if they don't understand it, even if it's like my mother's the oldest woman in the world, but she can go, the doctor gave me a copy of the histopath and here's what it said, and I understand the word benign, you know. And so, I mean, come on, you know, this isn't brain surgery, what we do, and it's being treated like you'd like to be treated. and never forgetting that.
We hope you've enjoyed this edition of The Five. If you have suggestions for future shows, email us at dvm360@advancedstar.com. And for the latest news, medicine, and business information, be sure to visit dvm360.com every day. Every day.